Max Davie, ADHD specialist and paediatrician based in Lambeth. And I wanted to talk about the use of medication, and one of the medications that we use in ADHD. It's very important that before I start that medication is not something that stands alone in managing ADHD, and we very much prefer that other things are tried first, include in terms of improving the school environment, getting the child in a better place emotionally, or in terms of the amount of sleep or exercise they get, and also improving the home environment and the relationships within the home before we try medication. But it is something that we offer, particularly if things are getting very, very tricky. So I want to talk about methylphenidate today. Methylphenidate is probably our first choice for most children with a diagnosis of ADHD. I talk a lot in clinic about what ADHD is, and I see it really as sort of riding around on a Tyrannosaurus Rex, so that your brain is slightly out of your control and difficult to rein in sometimes. And that introduces the idea that your brain is not the same as you. That's really important, because what methylphenidate does, if it works, is to increase the amount of control you have over your brain. And actually in doing that, it can make you less outwardly hyperactive, concentrate more, and a little bit less impulsive. So all of those core symptoms of ADHD that we talk about can get better. It doesn't have a direct effect on your schoolwork and your emotional state, but over time those things can very well improve, because you get more positivity, and also of course you're getting more headspace to actually do the work at school. And so over time the outcomes are really very good compared to not treating, in terms of staying out of trouble, getting better qualifications, better relationships, and so forth. So if it goes perfectly, it can be marvellous. But it's important to note that there are some side effects that you can notice. So for the first few weeks can be quite tricky. The person can get a little bit agitated, grumpy sometimes. This isn't necessarily something that is a mental health difficulty, but can cause some problems, particularly if the child is already agitated or anxious. Secondly, you can get some headaches or abdominal pain, tummy aches for the first few weeks. And so these things, the sort of agitation and the tummy aches, are really to do with the brain and the body getting used to this new situation, this new kind of chemical. And really it's a new kind of brain that you're riding around in. So it's not surprising that people get a little bit worried and anxious. Particularly, this is a problem in children with communication difficulties such as autism. And so those things go away after a while. What doesn't go away is the difficulties that you sometimes get with appetite. And again, none of these are always going to happen. So the appetite thing is kind of interesting. We start the medication, we give the medication always at breakfast. It must be given in the morning. And then it sort of is high in the body throughout the day. So lunchtime it's more or less at its peak. And that's when you don't get much of an appetite. And then it should be coming out of your system in the evening, and if it doesn't, you may have some problems with sleep, so it really needs to. And then your appetite then should return in the evening. And so if you give a child a nice big breakfast and a nice big dinner, you can usually maintain their weight and height, velocity, and keep them growing quite nicely. If you look at children who have medication versus no medication, there's a tiny, like 1% difference in height, which for most people doesn't matter, although it's easy for me to say because I'm 6'3". But generally speaking, we can manage that reasonably well. Then, of course, there is that effect on sleep I mentioned. Usually the two ways of dealing with that is, one is to change the preparation so it wears off quicker, but then you can get some problems in the evening. And the other way is to add a little bit of melatonin in. And melatonin is a medicine I'll maybe talk about in another video, which is very helpful for just acting as a little switch to tell the brain that it's time for sleep. The final thing to mention about the methylphenidate, though, is the effect on the heart. So you're sitting there and your blood pressure might be 120 or whatever. You have a coffee and it will go up to 125, or you stand up, it goes up to 125. Those kind of really normal fluctuations in blood pressure are what the medication causes, and for most people that's completely safe. The people that we take extra precautions about are those where there's a family history of early heart disease. So that would be things like needing a pacemaker or having problems with the rhythm of your heart in your 30s or 40s. Anyone on obviously either side of the family who have difficulties, or actually, if you don't know, it's worth doing an electrocardiogram. That's the sort of leads on the chest thing, just to check that everything's okay in the heart, and then we can go ahead. So in summary, I think the side effects of methylphenidate are annoying but generally harmless, and they go away if you stop the medication. I think once you don't, it doesn't work without careful attention to the environment. But if you do that and you try it, it's often worth it, because if it doesn't work, it doesn't work. It's fine. We can try something else, or we can just take a step back and come back to it later. I think the debate around medication can get quite heated, but really what we're doing is having a go, giving it a try. And if it doesn't work, it's fine. I'm going to put this video up, and if it goes well, that's fine. I'll do some more about some of the other things I've mentioned, and maybe some of the other medications or aspects of ADHD. I've got a series of very short videos, just which kind of very punchy things, just as an introduction, but these can be a bit longer. So if there are particular things that you want me to cover in more depth, I'm very happy to do that. But please comment below, particularly if you completely disagree with me and you think I'm being silly. That's fine. It's the internet. That's what it's all about. So for now, stay well, keep good, whatever that means, and I'll see you next time.